Have you ever wondered why your favorite sports star suddenly disappears from the game for weeks or even months? Most likely they've suffered a sports injury. In the world of sports, the thrill of victory, the agony of defeat, and the drama that unfolds on the field, court, or track are all part of what makes it so captivating. But beneath the surface of these high-octane performances lies a hard-hitting reality: sports injuries. These injuries, often sidelined by the glitz and glamour of the game, are a prevalent and significant part of an athlete's career. From sprained ankles to torn ligaments, from concussions to stress fractures, sports injuries run the gamut, impacting athletes across all disciplines. Whether it's basketball, football, tennis, or track and field, no sport is immune. These injuries can sideline athletes for weeks, months, or even end their careers prematurely. The impact of these injuries extends far beyond the physical pain endured by the athletes. They can result in lost playing time, affect team dynamics, and even impact an athlete's mental health. The recovery process can be grueling, requiring extensive rehabilitation, and there's always the lingering fear of re-injury. But why should we, as sports fans and budding athletes, care about sports injuries? Understanding these injuries gives us insight into the challenges our favorite athletes face off the field. It helps us appreciate their resilience and dedication as they battle their way back to fitness. For aspiring athletes, understanding sports injuries can guide training practices, influence game strategies, and inform injury prevention measures. Injuries are an unfortunate reality in sports, a common thread woven into the fabric of every athlete's career. They are a testament to the physical demands of the game and the risks athletes undertake every time they step onto the field. Sports injuries are a common but unfortunate part of the game. But what exactly are these injuries and how do they occur? Stick around as we dive deeper into this important topic. Sports injuries aren't all the same. They fall into different categories, each with its own unique characteristics. First up, let's talk about acute injuries. An acute injury happens suddenly during activity. Imagine you're in the middle of a game of soccer and you twist your ankle. That's an acute injury. It's immediate and often quite painful. Examples of acute injuries include sprains, strains, fractures, and dislocations. These injuries are common in sports that involve a lot of sudden movements like football, basketball, and gymnastics. Next, we have chronic injuries. The word chronic might make you think of something that's been around for a long time, and you'd be right. Chronic injuries happen over time and are usually the result of repetitive training like running, swimming, or any sport that requires the same motion over and over again. Tennis elbow is a classic example of a chronic injury. It doesn't happen overnight but develops slowly due to the repetitive motion of swinging the racket. Now let's move on to overuse injuries. You might think, wait, isn't that the same as chronic injuries? Well, not quite. While chronic injuries are caused by repetitive motion, overuse injuries result from pushing your body beyond its limits. They can happen when you increase your activity level too quickly, don't give your body enough time to rest, or use incorrect form or technique. Think of stress fractures or runner's knee. These injuries are common in endurance sports like long-distance running or cycling, where athletes often push themselves to the brink. Finally, let's talk about traumatic injuries. These are the ones that happen due to a sudden force or impact, like getting tackled in rugby or hit by a pitch in baseball. Examples include concussions, broken bones, or even spinal cord injuries. Traumatic injuries are most common in contact sports like rugby, American football, or martial arts. Each of these types of injuries has unique characteristics and requires a different approach to treatment. For instance, an acute injury might need immediate medical attention, while a chronic injury could require changes in training or technique to prevent it from getting worse. Overuse injuries often need a period of rest to allow the body to recover, while traumatic injuries may require surgery or extensive rehabilitation. Knowing the type of injury can help in understanding its treatment. But what leads to these injuries in the first place? Let's find out. So what causes these injuries that can sideline even the most seasoned athletes? Well, the answer is quite multifaceted, and it's crucial to understand that sports injuries can stem from a variety of factors. Firstly, let's talk about training. The way an athlete trains can significantly impact their risk of injury. Poor training methods such as overtraining or not varying the training routine can lead to repetitive strain injuries. These injuries occur when the same motion is repeated over and over again, leading to wear and tear on the muscles, ligaments, and tendons involved. So remember, diversifying your training routine is not just about keeping things interesting, it's about protecting your body too. Moving on, lack of conditioning is another major cause of sports injuries. Conditioning exercises are designed to build strength, flexibility, and endurance, all of which can help prevent injuries. If an athlete skips out on conditioning, their body may not be prepared for the demands of their sport, and this can result in injuries. So conditioning isn't just about improving performance, it's about safety too. Next up, we have improper equipment. This may seem like a no-brainer, but it's surprising how often this issue crops up. Wearing the wrong shoes, using equipment that's the wrong size, or not using safety gear can all increase the risk of injury. For example, running in shoes that don't provide adequate support can lead to injuries like shin splints or stress fractures. So, investing in the right gear isn't just about looking the part, it's about playing it safe too. Last but not least, let's discuss warm-ups and cool-downs. These are often overlooked, especially by amateur athletes, but they're crucial for injury prevention. Warm-ups prepare the body for exercise by gradually increasing heart rate and circulation, which in turn loosens the joints and increases blood flow to the muscles. On the other hand, cool-downs help the body to gradually return to its normal state, reducing the risk of post-exercise dizziness and stiffness. So spending that extra 10 minutes before and after exercise isn't just about feeling good, it's about staying injury-free too. In a nutshell, sports injuries are often the result of a combination of factors. They can be due to poor training methods, lack of conditioning, improper equipment, and inadequate warm-up or cool-down. By understanding these causes, athletes can take steps to prevent injuries and stay in the game. Prevention is better than cure, but when injuries do happen, it's important to know the best course of treatment. So, stay tuned as we delve into the world of sports injury treatments in the next scene. Injuries are an unfortunate reality in sports, but thankfully, there are treatments available that can get athletes back on their feet. Sports injuries can range from minor sprains and strains to major fractures and dislocations. But no matter how severe the injury, it's important to know that there are effective treatment options available. First and foremost, rest is a crucial component of treating any sports injury. It's the body's natural way of healing itself. When we rest, our bodies direct more energy towards repairing damaged tissues and cells. If you're an athlete, you might be eager to get back into the game, but remember, pushing yourself too hard can often lead to further injury. Following rest, physiotherapy is often the next step in the recovery process. Physiotherapists are experts in movement and function. They use techniques like massage, manipulation, and exercises to help restore mobility and strength. Their goal is to get you moving again as safely and effectively as possible. Of course, some injuries might require more than just rest and physiotherapy. That's where medication comes in. Painkillers, anti-inflammatories, and muscle relaxants are commonly used to manage pain and reduce swelling. These medications can help make the recovery process more comfortable, but it's important to remember that they're not a cure-all. They should always be used under the guidance of a healthcare professional. In some cases, surgery might be necessary to repair a sports injury. This is usually reserved for more severe cases such as torn ligaments, broken bones, or dislocated joints. Surgery can often provide a more definitive solution, but it also carries its own risks and requires a longer recovery period. After surgery, or in some cases alongside other treatments, rehabilitation is key. This is a comprehensive program designed to help athletes regain their strength, flexibility, and endurance. It often involves a combination of exercises, stretches, and other therapeutic techniques. The aim of rehabilitation is to ensure that athletes can return to their sport safely and confidently. Throughout this process, professional medical advice is invaluable. Sports medicine specialists have a deep understanding of sports injuries and their treatments. They can provide personalized guidance, taking into account an athlete's specific injury, their sport, and their individual goals. But it's not just about treating the injury. It's also about helping the athlete understand their body better. Learning about the nature of their injury, the recovery process, and how to prevent future injuries can empower athletes to take better care of their bodies. In the end, the goal of any treatment is not just to heal the injury. It's to reduce pain, restore function, and get the athlete back to doing what they love. It's about supporting them through their recovery journey and helping them come back stronger and more resilient than before. But as we wrap up this discussion on the treatment of sports injuries, it's important to remember one thing. While we have many effective treatments available, prevention is always better than cure. Remember, the goal of any treatment is to heal the injury, reduce pain, and restore function. But wouldn't it be better if we could avoid these injuries altogether? What if I told you that many sports injuries could be prevented? Yes, you heard that right. Preventing sports injuries is more than just a matter of luck or good fortune. It's about taking the right measures and making conscious choices. It starts with proper conditioning, which is the cornerstone of injury prevention. Conditioning includes exercises that improve strength, flexibility, and endurance. Incorporating a well-rounded conditioning routine can help to ensure that your body is physically prepared for the demands of your sport. Next, let's talk about equipment. Using the right equipment and using it correctly is vital in preventing sports injuries. This includes everything from wearing the correct shoes to using safety gear such as helmets, pads, and mouth guards. Each sport has its own unique set of equipment designed to protect the body, so it's crucial to understand what's needed for your particular sport and to use it consistently. Moving on, proper training methods are another key aspect of injury prevention. This means learning and practicing the correct techniques for your sport. For example, in sports like baseball and golf, a wrong swing can lead to serious injuries. In such cases, having a coach or trainer who can guide you in mastering the correct technique can be invaluable. Let's not forget the importance of adequate rest. Our bodies need time to recover from the physical stress of sports. Overtraining can lead to injuries, so it's essential to balance periods of intense activity with periods of rest. Listen to your body. If you're feeling tired, give yourself permission to take a break. Remember, preventing sports injuries is not just about doing everything you can to stay in the game, it's also about respecting your body and understanding its limits. Every body is unique, and what works for one person may not work for another. So take the time to learn what your body needs and respond accordingly. Preventing sports injuries isn't just about staying in the game. It's about respecting your body and understanding its limits. So we've taken a deep dive into the world of sports injuries, from the bruises that paint an athlete's body after a hard day on the field to the more serious injuries that could sideline a player for months. We've explored the vast landscape of sports injuries. We've learned about the different categories of injuries, from acute injuries like fractures and sprains to overuse injuries such as stress fractures and tendinitis. We've also delved into the causes of these injuries, highlighting how factors like poor training practices, inadequate gear, and lack of conditioning can contribute to these unfortunate incidents. Importantly, we discussed treatments from rest and ice to surgery and physiotherapy, and underscored the crucial role of prevention. Proper conditioning, correct techniques, and protective gear can go a long way in keeping athletes safe. Remember, sports are about enjoyment and healthy competition. So play safe, stay fit, and keep the spirit of the game alive.